And then he's like, he was shivers and he realised.
How long have you been on the Vale People First group?
My name is Gloria Harrison.
My name is Kelly Ann Rideout.
What were you here to discuss?
About to because about health checks.
Okay, first of all, did you know that you can have a check at the GP every year? Did you know that, a checkup?
Yeah.
No.
You didn't? Okay.
Go every week.
You go to your GP every week, do you?
Yeah.
Roughly, yeah. Because you've got to
Yes.
Yeah. Pieces.
Yes.
Have you had... Yes. Yeah. Have you had...
The letter that you receive, do you understand it?
No.
What do you do with your letter?
I do forgive it in my passport.
What do you think about that? Because it's your letter.
It is my letter. We can't understand long words, a lot of jargon.
So if it was clear and easy, you would be able to read it yourself. Yeah? But you do get health letters, but you can't understand them.
Yeah.
Yeah? Okay. How about you, Mike?
I don't get any health checks.
You don't get any health check letters once a year?
No, I don't get any like that.
No? Right. Okay, what do you think's wrong about that then?
I should get them. I don't know why they're not sending any out to me.
You don't, have you tried to find out?
No.
No? If you were receiving a letter, what would your letter have to be like?
Easy and easy.
Yeah? What if it wasn't? What would you have to do?
I'll remember to read it to me.
Yeah? And if it's addressed to you, if it's your letter, do you think that's good?
Yeah.
Right. Okay. All right then. So you're not getting a health check letter?
No.
Right. Okay. How about you, Glo?
I get one every 6 months.
You get one every 6 months, yeah? Do you understand it?
I can only understand. I can't understand the long letters.
The long words.
No.
Yeah. So if it was easier to read,
I'll take it down to my carers.
but do you think you should have to do that because it's your letter?
No.
And you'd be able to read it if it was clearer and easier to read?
Yes.
Yes? But you do get your health checks?
Yes.
Yeah? Okay. How about you, Kel? What's it like for you when you receive... Do you receive a health check letter?
Not every so often, but sometimes I give them to my mum to read, but I would like to learn to read it myself.
What would be easier to read, Kel? What does a letter need to be if you can...
Clear and easy.
Really easy? What would be in the letter? What do we use? What would you want to use in your invite letter?
Like pictures to help me.
Pictures, simple words?
And simple words.
Yeah? Okay.
You had a letter from the surgery inviting you to a checkup?
Yes.
Was the letter easy to understand and read?
Yeah.
Okay. Do you get sent a letter?
Yeah.
Do you read the letter? What do you do when you get the letter?
Read it.
So who do you give it to?
My mum and my sister.
And do they tell you what's in the letter?
Yeah.
What do you do when you get your letters from the doctor?
Go to the doctor, make a doctor.
You make an appointment for a yearly checkup. Okay.
Hard to understand.
So did you? Yeah.
That's why my social worker has to go through
Right. So you gave it to your social worker to help you read it. Okay.
Some of it was somewhat.
Have you ever had a letter from them inviting you to make an appointment for a health check?
Yes.
Did you understand the letter? Was it easy to read, or
No.
does anybody help you with reading it? Did you give it to someone to help you with it?
No.
Right. So you didn't? Did you go? Have you been? No. Would you like a letter from them?
Yes, it's the words a bit too slow.
Yeah. Okay.
Make a more bigger printer.
Right. So the letter was hard to understand.
Yeah.
Okay. So what work have you been doing to try and make this better?
Me computing some out.
Yeah.
I'm making them
Who did you go? What did you organise to go and do?
Go
going to the
to
GPs and
GPs and talk about better than that.
Yeah, you went to the GPs, a couple of GPs,
Yeah.
and what did you find out?
we found out about
Quadron surgery.
co-op surgery.
Did they show you their invite letters?
Only that one, but we offered to help him to make it clear and easy.
Why, Kel? Should we have a little look about what one looks like? Yeah? What did you say about that?
He frightened.
What did you say about being frightened? What did you think might frighten people about that invite letter?
That bit there, frightening people off.
So what, with tests and things?
Yeah.
Did I think you said that it'd be better off people getting there first, aren't you? Getting them there,
Yeah.
and then seeing what tests they...
Yes.
Yeah? So is that another invite letter there, really, is it?
Yeah.
Yeah? I think you thought that one was better than that one, didn't you?
Yeah, this one was better than that one.
Yeah.
Well, better than see these two?
Yeah.
Because you thought this one was better than the other one, better than this one?
Yeah.
Yeah? But there was still pictures on there of tests.
Yes.
And what did you want to do with them pictures?
Wipe them away.
Yeah.
Yeah.
You didn't like them, did you? You said that they put people off,
Yeah.
correct? So what did you offer to do?
Make
For the
letter
for the
clear and
managers.
easy. Like making this letter clear and easy.
So you produced that with the group, did you?
Yeah.
Yeah? What do you think is good about that letter compared to the other one?
Because it's got like more pictures.
Helping people who might not be able to read as well?
Yeah.
How about the size of it?
Yeah. Like the letters are more bigger
Yeah, because of what?
Their eyes.
because of their eyes.
Some people might not be able to see well.
Yeah.
Yeah? And can you remember when you spoke about the slip? This is your example here, isn't it? You said you wanted to attach the slip onto the letter
Yeah.
Yeah.
with all
Yeah.
like the addresses and doctors' names,
Yes.
but away from your letter.
Yes.
Yeah.
We did.
Is that
Yeah.
right?
Yeah.
Yeah.
That's what you wanted to do. So what did you do once you finished that then? What did you do with that? What did you do with that after you finished it? Where did you send it?
We sent it to the doctor's surgery
Yeah.
in an email.
And what did you tell them?
He produced a letter. He forgive.
That's the one that sort of letter you'd like to receive. Is that what you said in the email? Yeah. And we're waiting to hear,
Yeah,
aren't
we're
we?
still waiting.
Is that right?
Yeah.
Yeah. And I think courtroom surgery, what are they going to try and do if they can? Are they going to use that letter?
I think so.
Yeah.
You think so? What can you remember what she said, Joanne?
She said
What
she
she'd
won't,
like to try and do?
She would like to use like more pictures.
Yeah,
More
a letter
pictures.
like that, and then you go back
Yeah.
after a year
Yes.
Yeah.
to see if it makes a difference.
Yes.
Yeah.
Because if it doesn't make a difference, if this letter here, if that letter there doesn't make a difference, then we know that it's
Won't
not
be worth it.
the letter the reason why people are not coming
Yeah.
to their health
Yeah.
checks. What other reasons did you say?
No support, no transport.
Pardon, Kel?
No support
Yeah,
and no
no
transport.
transport.
And I know, no, you're still getting it.
Yeah. And obviously if they get a letter they can't read,
Yeah.
well,
It'll be
look
alright.
at Kelly's situation. Where do you live, Kel?
I live on my own in
Yeah.
25 Wooden Park.
Yeah, and what do you do with the letters you get?
I give them to my mum
Why?
because I can't read.
How about that one though? What would happen if you received a letter like that
I would be able to read some of it, but not all of it.
with the picture, but you know what it's about though,
Yeah.
and that would make a difference.
Yeah.
So,
Did you go for your checkup?
Yes.
Right. Did you go on your own or did you go with support?
I went on my own.
And were you happy with that? Would you
Yeah,
like
no,
someone
I'm
to
happy with
You're
that.
happy with that? Go on your own, Anne, or do you go with someone? Would you like to go? Would you like to go on your own sometimes, or would you rather have your mum?
Not allowed.
Who says you're not allowed?
My dad.
overall, what would you like to see happen with health checks? How could doctors and surgeries get people to come to their health checks? What do they need to do you think? What could they change?
Change.
I write a letter similar to this one.
Similar to that one that you've produced there, is it?
Yeah.
A clear and easy one.
Yes.
Yes. So if they change to a clear and easy letter, what else could they make sure?
And then
Resend that.
Yeah, important to attach the address and doctors' names and which surgery it is. That is important,
Yeah.
but you want to keep it separate.
Yes.
Yeah. And so you think by doing that it will change?
Yeah.
Yes.
Yeah.
Yeah.
Is it important that what if they're not aware of people with a learning disability who are in our community? It's going to be difficult to reach them, isn't it?
Yes.
Yeah.
So what do you think they could put out there to reach people who are not involved with doctors at the moment?
Like a poster to say,
But what would the poster have to be?
clear and easy.
Yes. So
And have,
advertise.
and have
Yeah.
medical
Yes.
centre.
Yeah. You could tell people that it's important to keep yourself well and happy.
Yeah.
Yeah.
Remember you talked about you need to feel happy as well.
Yes.
Because if you feel it, you can feel sad, and that's not good.
No.
No.
And that's called mental health, isn't it?
Yes.
Yeah.
Yeah.
So your main reason that you think people would come to checks more
Yeah.
is to what?
They should send a letter like this.
So change the way they invite you
Yes.
Yes.
with their letter.
Would you like to go for a yearly checkup?
Yeah.
Yeah. Okay.
Yeah, I've asked Jane and Edward about that.
And who do you go with in the doctors, John? Do you go on your own?
Mummy.
Would you like to go on your own sometimes?
Yeah.
And then your own or with someone? Are you happy with that, or would you like someone to come with you? You'd like someone to go with you?
Yeah.
Could you? Have you got anybody to ask to come with you?
I don't know who to ask.
You don't know who to ask. The letter inviting you to? No. You haven't had a letter. So, have you been?
No.
Would you like to go if you had the chance?
I would. I'd like somebody to go with me to give me support.
Okay. Anybody want to say anything else before we go? Have you enjoyed working on this project?
Yeah.
Yes.
How important is it and why?
Very important.
Why?
Because it's important to have health checks so they know that you're healthy.
What can it do?
It could kill you.
It can save your life if you have them.
Yes.
Yes?
Yes.
If somebody understands a letter.
Yeah.
Yeah? Okay?
Yeah.
Right, thanks guys. Well done.